So welcome everyone to this dialogue about developing national plans for street connected children. So we'll be in discussion today with Catherine Cherry from Bahay Tuluyan in the Philippines and Gonzalo Sayas from Gurises Unidos in Uruguay. So they've been leading the civil society efforts for the development of national plans on street connected children in their respective countries. And they'll be sharing their experiences with you today. So Catherine, can I ask you to briefly introduce yourself?
Thank you, and hi everyone. My name is Catherine Sherry. I am incoming executive director at Bahay Tuluyan in the Philippines. We are a children's rights organization working, oh, there you go, so you can see it behind me, to respect, protect, fulfill children's rights. So we run a whole lot of 10 different programs across 3 provinces in the Philippines. So it's very nice to be here today. Thank you.
Thanks, Catherine, and congratulations on the new job. I did not know that yet. Gonzalo, can you introduce yourself?
Sí, gracias, Lisette. Buenos días,
Good
buenas tardes.
morning, good afternoon, maybe for some of you. A pleasure to be here in this dialogue. I'm Gonzalo Sánchez. I'm the director of the organization Gurises Unidos. Gurises Unidos means something like children together, something like United Kids. We are an organization that works defending the rights of children and adolescents in vulnerable situations. In Uruguay, we have actions that have to do with Latin America. Our 3 basic lines are public political incidents, attention, direct attention to children, and generation of knowledge. And all the problems that we work with street children, street connected children. We work with children that are in situations of sexual exploitation, work. Unidos Unidos has been implementing the national plan to approach street connected children in Uruguay, and I am proud to be here with Lisette and with Catherine. We've been working for a long time now. It's a pleasure to be here.
Excellent, thanks. And just to set the scene a little bit, both of the national plans that Catherine and Gonzalo will be talking about have been very strongly influenced by UN General Comment number 21 on children in street situations that was adopted in 2017 by the UN Committee on the Rights of the Child. And Uruguay, the government of Uruguay, has been a very strong supporter of the UN resolution that resulted in the development of the UN General Comment 21. And of the General Comment itself, the government of Uruguay committed to implementing the provisions of the General Comment 21 even before it was fully adopted and before they knew what was in it. They were very, very strong supporters, and they've always seen themselves as a pioneer country, and have been recognized as a pioneer country for the rights of street connected children in terms of the General Comment. And this has also really meant that the process in Uruguay was therefore very much initiated and owned by the government in very close collaboration with civil society. And in the Philippines, after the General Comment was adopted, the Subcommittee for the Protection and Welfare of Children in Street Situations was revived, and under the leadership of Bahay Tuluyan, worked to develop the national plan for children in street situations there. I won't go into too much detail because we've got the 2 experts here who will tell you all about it. And before we dive into, exactly how these plans were developed, how they got the government support and everything, it'd be good to hear from both a little bit more about the situation for children in street situations in your country. So let's start with Catherine. Could you tell us a little bit more about what the situation for street connected children in the Philippines is like?
Sure. So the Philippines, for those who aren't that so familiar, we're in Southeast Asia, a population of around about 110 million. one of the most densely populated countries on earth. Lots of highly urbanized cities. Metro Manila, or Mega Manila, is really it's not a very large metropolis, but it's a very high population. There's been a lot of rural to urban migration over the last several decades. The issue of children on the street emerged in sort of the 80s, and the response from the Philippine government through most of the last 30, 40 years has been to seeing children on the street as out of place, and responding by removing children from the street, often against their will, often into government shelters that are completely inadequate and ill-equipped to deal with their needs, and where children don't stay very long anyway, so end up going back onto the street. So there's no really good, reliable estimates of how many children are on the street across the Philippines. You know, the most reliable estimates that we have are it's in the range of about 300,000 across the country. But that's kind of really just based on assumptions and not really on counting children. And children are on the street for a variety of reasons, mostly induced by poverty and abuse and exploitation, violence at home, inadequate housing, lack of spaces to play, to spend time. They're on the street socializing, they're on the street escaping abuse, they're looking for livelihood, they're looking for ways to earn money to survive. So it's become very much part of the fabric of Philippine society, Philippine cities particularly, and it's a problem that the whole the country and all different local governments across the country are grappling with and trying to understand, and not having a great deal of success in combating so far.
Thanks, Catherine. And how does that compare to the situation in Uruguay, Gonzalo?
Bueno, la situación en Uruguay.
The situation in Uruguay, when you talk about street-connected children in Uruguay, we have to go back to maybe 30 or 32 years ago, when our organization, Gurises Unidos, was born. Maybe I will take just a couple of minutes to tell you how Gurises Unidos came about, because that explains how the problem of street-connected children has been developing, and what were the responses that we could give to attend the street-connected children. In 1989, in our cities, especially in the capital city, Montevideo, we started seeing a new expression, a strong expression of poverty, and that is street-connected children. It's not that there were no street-connected children before, but there were few. They were kind of invisible. But around the year 1989, we started to see an increase in their numbers, and there was no response. There was no methodology to take care of these children. The only methodology that was available to take care of these street-connected children that had the government was orphans. Or that is orphans that would take care of them 24 hours, and the UN system and UNICEF and the government and the civil society decided that there was a need for the development of a methodology specific to take care of these street-connected children to this new phenomenon that was taking place, and that was being seen in our cities. So we developed a project. The project was called Gurises Unidos. It was a project that was meant to last 2 years and would generate methodology and would take care of children and adolescents in the street. That project lasted 2 years and was valued as very positive, and what started as a project ended as an organization of the civil society, which is Gurises Unidos until now. And we are 32 years old now, developing methodologies to take care of these boys and girls. The thing is that when Gurises Unidos started developing this methodology, we shared that methodology with other institutions, and the state and different organizations started approaching and developing other programs that could give response to this problem of street-connected children. Now we have more than 30 years experience of the program, taking care of these children, street-connected children all around the country. And that methodology and those programs are mixed. That means they are developed by the civil society and by the government, and many of them have financing by the government. So the problem of street-connected children has been approached historically in a comprehensive way between the government, between the state and the civil society. The problem of street-connected children in Uruguay and in the region is closely linked to the economic situation of countries. Where the countries get poorer, we have more children in the streets. The problem is that the world and the region and Uruguay changed a year ago because we had this pandemic arriving. The economic situation of Uruguay before COVID was one situation, and with COVID, this is a new situation. But we're not talking only about the health issue, we're talking about social issues. In Latin America and the Caribbean and in Uruguay, most of the children, most of the poor people are children. And when we talk about poor children, many of them try to survive, developing strategies that have to do with the streets. So what we have here is that, regretfully, we don't have the exact number right now, because we still have to develop the quantification of street-connected children as part of the objectives of the plan. But what we do have is that there are more poor children now, so we have more street-connected children. And so the situation of street-connected children in this past year in Uruguay, as well as in the region, has worsened.
Thanks, Gonzalo. Yeah, I think we can see that around, and I'm sure lots of the attendees of today's webinar will recognize that COVID has greatly worsened the situation for street-connected children globally. Gonzalo, you were saying that historically the government and civil society have worked very closely, and there's always been commitment from the government to address the challenges that street-connected children face. Where do you think that strong commitment from the government came from?
I think it has to do with the origin, how this response was originated, how this response to this problem of street-connected children. The programs and the policies that take care of children and adolescents in the street have this characteristic that has to do with this mixed characteristic. It has always been a problem that was approached with a mixed view between civil society and the state. Since its origin, when the first project was originated that intended to create a methodology, until today, where we could put up a plan to cover not only the view and the interests of the government, but also the civil society. We say that really in these 30 years, the government, or rather the policies that are focused on street-connected children has been a second generation policy. We understand that the first generation policies are those policies that are developed, implemented, monitored, and evaluated only by the government. And the second generation policies are policies developed, implemented, monitored, and evaluated from the government and the civil society. This has this is what happened for these 30 years with the programs and policies that approach street connected children, and what comes from the General Comment 21 and the National Plan is that these policies have turned into a third generation policies. And that means that design, implementation, monitoring, and evaluation has the participation not only of the government, not only government and civil society, but also government, civil society, and users or beneficiaries of these public policies. The beneficiaries in this case of this policy are the street connected children and adolescents. And that, I think, is the reason why we could accomplish this and what we are very proud of, this achievement, this third generation programs and policies, social policies.
That's really useful background, I think, Gonzalo. I believe in the Philippines, the situation has been quite different, where the collaboration between government and civil society is much more recent, where I think, Catherine, correct me if I'm wrong, but you've had to much more advocate for this national plan to come into being, and it was much more, efforts from civil society as well. So could you tell us a little bit more about how that process started in the Philippines?
Yeah, thanks. Yeah, I think every time I hear Gonzalo speak, I'm very jealous of Uruguay because I think it's such a, a cooperative situation. And it's not that the Philippines isn't, but I think to some extent there's a sense of being overwhelmed at the government level, like really not knowing what to do, feeling that the problem is so big that everybody, nobody really knows how to handle it. And I think what changed in the Philippines. So there was a project set up in the mid 90s as a project was partly with UNICEF, but also local government units and government agencies, NGOs were involved in trying to coordinate responses. Unfortunately, it was only ever a project. It didn't become institutionalized, and it gradually kind of just fell apart, and everyone went back to just trying in their own little ways to grapple with the problem. And I think when the general comment came out, we were really excited as Bahay Tuluyan because we felt that we had something, a tool that we could use to in the advocacy. But also, I mean, we were really surprised. It was actually the government that initiated, that kind of called everyone together and convened everyone in response to the general comment and said, how can we use this? So I don't think it's that there was, I don't think it was that the government wasn't willing, but I think it really didn't feel that it had necessarily knew what to do. And I think what the general comment gave us was, for the first time, sort of some really tangible, internationally kind of accredited or internationally condoned way to respond to the issue. And that sort of gave the impetus. I mean, I think it's very important also to acknowledge the role that the civil society played. It wasn't just Bahay Tuluyan, but other NGOs in the sector, and we very much supported and encouraged that. And across the government agencies that we've worked with, we've had differing levels of support and engagement. We've had from the Commission on Human Rights and the Council for the Welfare of Children really, full support, and some of the other agencies have been there, have been willing, but I guess maybe hoping to be led a little bit more than leading the process. So I think that's where the role of civil society has been, to bring in, to encourage and support, to bring in best practices and ideas about how we could develop the plan.
And do you think this process would have kicked off if the general comment hadn't been there, if it hadn't been adopted?
Who knows? Maybe not. I think at some point there's probably something might have changed eventually. I can't say that nothing would have happened ever, but I definitely do. This definitely triggered it. It definitely triggered it. So it was not long after the general comment was released that that this, what had become basically a defunct network, and it hadn't been active for quite a few years, reconvened, and what happened was then it was institutionalized. So it's no longer just a project, it's an institutionalized subcommittee under the Council for the Welfare of Children. So for the first time, there is really formal institutional mandate for children in street situations. It's still at the Council for the Welfare of Children, which is not kind of the highest body, but it is it's the highest policy making body for children in the Philippines. It does lack some power and budget to make big change, but I definitely think that, we might have been 5 or 10 years off if it wasn't for the general comment.
Well, it's good to hear that it had such an impact for you. And Gonzalo, how do you feel the general comment influenced the development of the national plan in Uruguay, not only in its, establishing or initiating the process, but also in the national plan itself and the content of the national plan?
Yo creo que
I believe that the General Comment 21 enabled us to generate minimum standards of a national plan. What I mean, to generate minimum standards for the development of public policies. And that is important to think about public policies addressed, in this case, to boys and girls, with the clear perspective of rights of boys and girls. That means human rights. I mean specific human rights of boys and girls. It's a very important element, and what it does, it raises the content of the plan to such an extent that it's impossible to think about developing. If you build a plan and you think about with the perspective of a children's rights, like as expected by the General Comment 21, you can't think about that without the participation of them. So this raises the level and the quality of the national plan. I think it was a very important element. I want to say this, there are not a lot of background in Uruguay of a public policy that is thought about contemplating the voice of the users of the public policy, and contemplating, and unless if we think that those users of public policy are children and adolescents. So I think that was one of the big achievements of the plan, of the General Comment, sorry.
That's great. And I think it'd be interesting to dive a little bit more into those users, because I think in both countries there was a very strong element of child participation in the development of the national plan, which was really important. Catherine, could you tell us a little bit more how children's voices were considered in the development of the national plan?
Yeah, sure. So for us, it kind of happened a little bit it wasn't necessarily planned from the beginning, but we did have a what we call a Street Children's Congress in early 2019, where we convened children from street situations from various different places, and they helped they came together for 3 days to look at the General Comment, to consider it and understand its content. It was the first encounter they'd had with the General Comment for many of them. And they also reflected on what it meant in their situation and in their environment, and how it. So there's a photo of the children. So looking at the different thematic areas of the General Comment and reflecting on what it meant in their life, and basically from there they developed different outputs, creative outputs. So there was a film, rap song, theatre performance, visual art, and photography that they used to tell their stories, or to try and convey what they saw as the major gaps and the major areas that needed addressing in relation to what the General Comment promised, and as it compared to their own lives. Those outputs were then presented in a dialogue with the government agencies that went on to form the plan. So we had, during International Day for Street Children in 2019, the children actually had a direct opportunity to present those outputs and to really share their thoughts and ideas. And it was that group then that went on to develop so that's actually a photo of the International Day for Street Children. So one of our representatives sharing some of the content of their statement. And then from there, all of those inputs were then taken on board by the subcommittee as it developed the national plan for children. So then since then, we've also had children involved kind of in reflecting on the plan. We're at this stage now, we're about to start working on localizing the plan. So we hope to again be able to involve children in that process of localizing it in individual local government areas.
That's fantastic to see. And Gonzalo, can you tell us a little bit more how that went in the process in Uruguay?
Nosotros, el proceso
The process of listening, incorporating the voice of children in the development of the national plan was one of the elements that was very important for us. We wanted to listen to the voice of children from all Uruguay, not only the capital city, but rather we wanted to revise, to listen to the voice of children of all around the country. And that's when we went to different departments to get in touch with them. And we had this view game through games. That's how we approached them, and we could get their views, their needs, and their interests. And what we realized is that it was interesting not only to listen to this boys and girls and adolescents, the street connected boys and girls and adolescents. We thought also it was important to listen to other groups of children that are organized as well, that had been working within participation processes, that had been working in processes of contributing to different programs and policies. And we also asked them, and if you look into the plan and you see the systematization of that experience, the voice and the proposals of boys and girls are present, largely present. There is one of the topics that they stressed a lot had to do with the component of being able to circulate, to be able to incorporate what they call as cultural elements. They want to have ownership of the city and to use the spaces that they have as citizens. And that is one of the 5 key elements established by the plan as a strategy. So it was an experience that was very interesting. This experience where we adults learned a lot, because we realized that, well, rather than realize, we confirmed that boys and girls have a lot to contribute to public policies in general, especially when they are the beneficiaries, they are directly involved in these public policies.
Yeah, it's very important that their voices are included. That's just wonderful to hear. And I've got so many follow-up questions I'd love to ask, but in the interest of time and trying to get through some of the other topics and making sure that there's enough time for some of the attendees to answer their questions as well. And please do type them in the chat box or in the Q&A if you have any questions for Catherine and Gonzalo. We actually also have James from Laughter Africa from Sierra Leone on the call here with us today, where they're actually taking some very first initial steps towards developing a national plan as well. And they've held some really interesting consultations with children to ensure their voices are included. James, if you're able to and are able to unmute yourself, could you explain a little bit more about what that process has been like for you?
Yeah, it's been absolutely fantastic. In December, we consulted with 56 girls living on the streets in Susan's Bay. and 56 boys living in the streets in the city centre. And we used a similar structure to the exercise for the International Day for Street Children on the this year, with the flower, the bugs, and the bug spray. And the young people really responded to it really well. And having their involvement and their participation was such an important part of the process. Through the consultations, we learned so many things that we as NGOs had not even considered. Some of the ideas that we'd never even thought about included free daycare facilities for the children of the girls living on the streets. The issue of police raping the girls, and that happened over COVID with the curfew and the restrictions. They were raping girls a lot more. And the issue of Chinese fishermen who were abusing and killing some of the girls living on the streets. We repeated a similar exercise for the International Day of the Street Children in March and April for the children living on the streets in Porti. And another issue arose that we'd never considered, which was about free wheelchairs for disabled children living on the streets. Now, all this information really did enrich the national strategy. And it really highlights the fact that any NGO involved in helping develop any national strategy should not assume that they know anything about what the children living on the streets need or think. You have to do genuine consultation with them, and it's a real eye opener when you do, and you can learn so much from the process.
Thanks, James. That's really great to hear. And yeah, it's interesting that often we think as NGOs working so closely with children, we know their issues, we can represent their issues, and it's the government that we need to and raise awareness. But often when we have genuine dialogue and consultations with children, there's so much we learn ourselves. And as adults, we shouldn't assume that we know exactly what they're going through. So I think that's really interesting to hear from you and to say that so clearly. I'd be really interested to hear a bit more from both Gonzalo and Catherine about what the biggest challenges were in developing the national plans and how you overcome that. So let's start with Catherine and then we'll move to Gonzalo.
Well, besides COVID, so we, it's basically the biggest challenge for us has been getting the commitment of the government agencies, getting committed representatives from each of the government agencies to be in the process. So what's happened often is, you know, when we have our committee meetings, it's different representatives every time, and they don't necessarily have decision-making power, and that really slows the process down. And quite honestly, if it hadn't been for civil society leading the process, providing a lot of the input, providing the framework, providing the funding for the consultant who kind of helped to facilitate the workshop and help to write up the initial drafts of the plan, etc., it may not have happened. So I don't want to kind of gloss over anything. It's been a very difficult process. It took us basically close to 2 years from the time we had the initial workshop to the time the plan was finally signed off, and then we were able to launch it in April this year. So it really has taken a very long time, which is frustrating. You know, I mean, the plan that we devised is 2021 to 2025, and we're halfway through 2021, and we haven't yet localized it or kind of translated it into an action plan. So we fully anticipate it's still going to be slow. It's still going to be probably frustrating more often than it's hopeful, but at least we have the framework in place. We feel like we really do have something that we can go to our local governments with. We have a reference point. It does become part of the policy framework overall for children in the Philippines. So yeah, I think, you know, and I think, I mean, from everything I've heard from Gonzalo, I think it's maybe quite different. I think it is quite different, but yeah, very challenging.
So let's hear from Gonzalo and how different that may have been.
Yo creo que
I think that the main challenge that we had to overcome with the national plan was to get that the victim understands that a national plan addressed for street connected children, that a policy addressed to street connected children couldn't be exclusive of the government institution that take care of the children. The government institution that develops policies for children, it was necessary to articulate the different institutions that are part of the government: health, education, safety, security, housing. And that change was a big challenge. To go and sit around the table with the education authorities and to tell them, we need to agree with you to generate some actions for street connected children.
Autoridades de educación nos miraran sorprendidas.
To look at us with surprise and tell us, no, we don't have street connected children. And us telling them, yes, that's the problem. That's what we have to consider. That was part of the challenges that the implementation had to overcome. The development of this national plan, to get involved different institutions of the government. The second challenge was not only getting them involved, but also generating agreements and commitments. And that is an element that in Uruguay is difficult. To get different sectors, different institutions to agree and articulate, that is very difficult. Articulation between sectors, the different sectors, the different institutions to articulate and agree in to give a comprehensive response. So the big challenge had to do with the time that it took to generate those agreements and those articulations, and to bring awareness of some institutions that this topic of boys and girls and adolescents that are street connected is not only the issue of the specific institution that develops the policies, but rather it's an issue of many ministries and many institutions.
Yeah, that's very interesting to hear, Gonzalo. And I think that's often a challenge to bring all these stakeholders together. So if we now kind of turn towards, these plans have been adopted in both countries, in Uruguay quite a while ago, and in Philippines quite recently. So if we now turn towards more the implementation side, if we look a little bit at, what are the first steps that have been taken? So Gonzalo, what has happened since it has been adopted? There's been COVID, there's been a change in government. I'm sure that's posed further challenges. So if you could tell us a little bit more about where implementation have gotten to so far.
Once the national plan was approved and we launched it in the parliament, we launched it in parliament, and we had the participation of all the institutions, all the ministries, and we signed off. Lisette was there virtually, but you participated, you were there. And that launching, then we had national elections, we had a change in government, and we had new authorities. The new authorities take office on March 1st, on March 1, 2020, and March 13 of the same year, we land COVID in Uruguay. So when we were going to start implementation of the new national plan, basically COVID arrived, and that was a big challenge. Now, what we say, and we are convinced, is that the national plan basically was an incredible response for street children with COVID. If we had not this national plan, the situation of street connected children and adolescents would have been much, much, much worse. Thanks to the national plan, we could despite the lockdown, we could have a declaration that the programs for street connected children are essential. And because of this declaration of essentiality, the technicians that work in these programs of street connected children could continue with the work. We could continue taking care of them. We were not included in the lockdown. We were not included in the lockdown policy. Why? Because the government understood that it was necessary for us to continue taking care of these children. And we were like essential workers for the government. And for that, the first persons to receive a vaccine against COVID were those technicians who work with street connected children and adolescents. We also achieved the development of actions, specific actions, especially what had to do with nutrition in the programs that take care of street connected children. So today we're working and generating actions of incidents because since last Monday in Uruguay, we started vaccinating adolescents
17 años contra el COVID-19.
with ages ranging. We are generating incidence actions to get street connected children and adolescents to be vaccinated. So what we are saying is that that was achieved, that could be done thanks to the national plan. And thanks to the existing, because we have a national plan and we have a follow-up committee of that national plan. And this committee, this follow-up committee of the national plan has members of the Social Security, Social Development Ministry, Education Ministry, the institution that develops policies, and the Health Ministry, and by the civil society. That committee was very carefully following these actions, and they could manage to keep these actions in place all through this period with COVID. So we think that the achievements of the plan were important. They were substantial for the well-being of these children. Now, what is left, we expect that when COVID is over, we expect to start with the more programmatic guidelines, and we will have one important element, which is part of the plan, which is the step one of the plan, which is quantification of children and adolescents street connected. This quantification was going to take place in April last year, but we had COVID. So that is the first thing we're going to do in August when we expect COVID to go away.
Thanks, Gonzalo. I think that's an incredible example of impact that the national plan has already had, that because this plan is in place and this, subcommittee from across different government departments and ministries was in place, that, the street workers and social workers were exempted from the lockdown and they could be vaccinated, and therefore, the situation for street connected children did not become as detrimental as it could have been during this pandemic. I mean, that's incredibly powerful, I think. So Catherine, how's that been in the Philippines? It's of course been a lot more recent. Earlier you were talking a bit that, there's now steps towards localizing this national plan. Could you tell us a little bit more about what's taking place and what are the plans for implementation in the Philippines?
Yeah, sure. Yeah, so it's quite different when we're looking to Uruguay to hopefully follow in their example and adopt some of their successes, hopefully. But our plan was only officially launched in April on International Day for Street Children, so it's not quite nearly 2 months since the launch. And I guess the situation here has been very, very difficult. I mean, everywhere. It's been difficult under COVID, but in the Philippines since March 16 last year, every child 24/7 has been prohibited from being on the street at all in any circumstances. So it's been extremely difficult for everybody to, to even talk about implementing and to, I mean, even for us as an NGO with accreditation and authority to work with children and I mean, a bit like Uruguay, we've got exemptions. We've been allowed to work because the children's basic existence on the street at any time has been illegal. That's really hindered any access that we can provide directly. So it's been a very, very challenging period, and continues to be a very challenging period. It's been going on to over 15 months now of this situation. However, we are working. So one of the, again, I guess, pushed and led a lot by civil society. We are now working, starting off with the city of Manila, and trying to come up with plans to localize. We're also at the national level trying to get each of the, so in our plan there are specific deliverables for, and each deliverable is assigned to a particular government agency. So we're trying to get those government agencies now to work on putting those into, tangible plans as part of their agencies. And realistically, as the plan's just been approved, the process of getting budget assigned to that, obviously takes time. So we expect probably implemented budget-wise for most agencies in 2022, just because of that lag in times, in terms of getting it implemented. So yeah, we're still in the very, very early stages, and I think what's going to be critical is like Gonzalo talked about, having that follow up and having that consistency and holding people and making people accountable. I think that will be a challenge at our end.
So in the interest of time, I want to wrap up there, but just before we go to the questions from attendees, I just want to ask both of you, what advice would you give to others who are interested in advocating or are already advocating for a national plan in their own country, especially if governments are hesitant, maybe because of funding, budget constraints, etc.? What would you say to others who want to advocate for a national plan? Let's start with Catherine.
Yeah, look, and I just saw a question in the chat box as well about how, expensive this is to do. And look, quite honestly, I still think it's cheaper than not having a plan. The way, the responsive, reactive way that the Philippine government has responded for 30 years has made no dent in the problem. So continually just responding on an ad hoc basis in ways that actually provide, that cause long-term harm, that don't really make any impact unless it's negative impact, like that all of that costs money too. So stopping, pausing, coming together, thinking about, better ways to do things. It has to be a more cost-effective way to respond to the problem, I think. But at the same time, it doesn't have to be hugely expensive. One of the positives of COVID, I believe, is that, for many networks and partnerships that we're part of, we're getting much higher attendance at meetings because everybody can sit at home and just log on, and we don't have all the issues of travel. We've also found that we've had a broader participation across the country, rather than just being a Manila-centric kind of operation. So I think there are ways that it doesn't have to be an expensive exercise, but I do think you need to think about how you invest and how and where you want to invest. And I think if after 30 to 40 years of attempting and not making a dent in the program, if we just keep doing the same thing over and over again, then that's the definition of insane, really. Like, how can you not stop at some point and go, okay, maybe we're not doing everything right, maybe we can choose to do this better, and that's got to, it's got to be a good investment.
Yeah, it sounds from what you're saying that actually, for those governments who say, we are budget constrained and we can't afford to have a national plan, that's why they should have a national plan, because what they're doing now is actually a lot less cost effective. And from your own side, Catherine, the process you went through, is one of the questions was asked in the chat box as well. Was that very financially very expensive, and how did you fundraise and fund that?
No, it wasn't. I mean, we've had support. We've had support partly from CSC and the Red Nose Day Fund, but I mean, that hasn't really been, a big part of it. I mean, it's time. We've had to give time, and we've had to decide that that's a priority. And it's been mostly me from our organisation who's been involved in the consultations and leading the meetings, etc. But beyond that, it hasn't been. We haven't. I mean, for things like the Street Children's Congress, yes, we definitely had to get funding from that. We got funding from different partners, but as I said earlier, that wasn't necessarily. It wasn't designed just as lead up to the strategic plan. It was kind of a standalone activity that ended up helping contribute to the national plan. But definitely for children's participation, that's costly. And that kind of needs investment, but it's also something that is interesting and innovative, and I think funders are interested in things like that are really directly participative. So it does need, I don't want to dismiss it and say it's easy to do, but I think it's also something that doesn't have to be cost prohibitive if you're really ready to and willing to prioritize it and integrate it into things that are already happening, and kind of make it as much as possible, a bit like we did. I mean, the Street Children's Congress has contributed in lots of different ways. It hasn't just contributed to the national plan, it's contributed to the alternative reporting to the UNCRC. It's contributed to just general public awareness raising and dialoguing with the government. So there's lots of different ways that we've been able to kind of amplify the impact of that little bit of funding that we've got and grow it. This year, I mean, not necessarily just because of funding, also because of COVID, we're going online. So we're going to do a national children Congress for children in street situations online. So hopefully the expenses will be even less. But how we get everybody online is going to be the challenge.
I look forward to seeing how that's done, and love to learn more about how you effectively do that, Catherine. Gonzalo, what advice would you want to give to anyone listening in?
Lo que diría es que
What I'd like to say is, to give any sort of response to children, you need a plan. It's not possible to produce an action, a public policy, if you don't have a plan. You can have a national plan with a lot of money, and that will get better results. There can be a national plan with a very little funding, and that will lead to worse results. But it is impossible to think about the problem of street connected children if you don't have a plan. Because basically the plan implies the articulation of actions with.
O sea, no hay respuesta a niños en situación de calle sin un plan. Ese plan podrá.
You cannot take care of these children without a plan. The plan will have more or less budget, and that will explain the better or worse results. So money shouldn't be an obstacle or a problem to develop a national plan. Money would be an obstacle to raise the quality and the volume of results, but the national plan is necessary. Some elements to make good plans, we have already covered that. It has to incorporate the government, the civil society, and the children themselves. And it is also necessary to incorporate the different government institutions and agreements. So I believe that those are the key elements. But it sometimes happens that governments tell us, no, I'm not going to make a plan because I have no money.
Deberíamos poder contestarles con ese poco dinero que hay.
And what I say is, well, we have not much money, but how can we need a national plan. If we have little money, we need a plan to make a better use of that little money, because the results not only have to do with the money, but also with what we said, the articulation of different institutions.
Thanks, Gonzalo. I think that's great advice. I want to turn now to questions that have been asked by the attendees. And thanks all for staying with us so long. And thank you, Catherine, as well. It's already late in the Philippines, so we will try and not make it much longer for you, but it'd be good to run through some of the questions. And if anyone still has questions, but you haven't popped it in the chat box or in the Q&A box yet, then please do so and we'll try and get to it. So there's a question from Minded in Tanzania saying that challenge and visibility of children in street situations in the Philippines is huge, but not sure about Uruguay, and that in Tanzania he feels there's not enough pressure on the government to do anything because the situation isn't bad enough in a way, or it's not visible enough in a way. So what are your thoughts on what to do in a situation like that? Maybe Gonzalo, you could answer that, as I know that in Uruguay, the situation is not as bad, if we can call it that, as in the Philippines. There's not as many children on the streets in Uruguay. The challenges aren't as huge as they are, for instance, in the Philippines. So what made the government decide that even though it's not as big a problem, we still need to really make sure that no children have to be on the streets?
Creo que lo que tiene que ver
What has the answer is, we believe that it's necessary to bring awareness, to make the governments to be aware. It's important that this awareness, we have to reveal the vulnerability of this street-connected children. And for us, we had a very important instrument to develop this quantification. It's an important instrument to develop quantification. The first quantification of street-connected children in Uruguay was not carried out by the government. The first quantification of street-connected children on a national level was carried out by Gurises Unidos, was presented by Gurises Unidos, and that implied and had the result of amplifying the programs addressed to these children, because quantification enabled us to tell them how many, where are they, and what do they do. And that element, when you bring that to the communication media, that enabled us to bring awareness in the community, and that enabled us to generate incidence actions to make so that the government could take action to give a response, because this problem was made visible from this organization of the civil society with numbers, with statistics. And that, I think, was one of the key elements when you want the government to be involved. To not only the government, but also you have to bring awareness to the society in general, and quantification and numbers are a very good instrument for that.
Thanks, Gonzalo. There's some questions around implementation as well. So that, it's great to have a plan, but, how do we make sure that it actually makes a difference for the children? So Catherine, if you could talk a little bit about, how confident are you that, this actually is going to make a change for the children that you're working with and that it's aimed at? And how also has the government committed to putting a budget towards all these actions to, really make it more tangible and actually make sure that it is realized and it doesn't just stay a beautiful piece of paper?
Yeah, so as I said, I've given all my disclaimers earlier that we're still in very, very early days, and it's still to be seen how this translates into action. But what I do think, and I think that's also, for us in the Philippines, it is a bit of a different situation where the government isn't always at different levels. Sometimes at the moment, particularly the national government is quite anti-human rights and very non-child friendly. But what I do think that the plan has done is it has empowered those who are child friendly. It has empowered those who are it's kind of a rallying point. So we're seeing, while we haven't yet seen, some of the key local government units committing, big amounts of budget, or even some of the national government agencies not necessarily doing that yet. What we are seeing is some outliers, some smaller local government units in, different places jumping on board the bandwagon, using it as a platform. And I think what we're likely to see in the Philippines, I think the way things tend to work is that there needs to be some successes for it to be more broadly adopted. So even though it's there as a national plan and a national framework, what I think we're going to need now is to make those some positive strides and make some positive impact. And just go back to that previous question, I think in many ways, the situation about, if there's the issue of children on the street is a relatively small problem for us, that would be a wonderful luxury, because then you could tangibly show, okay, we've gone from 5,000 children on the street to 4,000, whereas I think in the Philippines it's much harder for us to be able to show that kind of impact. So what we're going to now have to do, to a certain extent, is scale it down and focus in on particular pilot areas where we hopefully will see some success. So, for example, there's we're working with a great civil society organization a bit further south in the Philippines who has a really good relationship with their local government unit. They're all on board. They're all supportive. They were present during the launch of the plan, and they're wanting to get on board. So if we can perhaps see, some positive steps in that local area, then we can, maybe start to scale it up. Whereas if you're starting with a smaller problem to begin with, it could be at the national level you start to see those changes almost, much sooner. And I don't think, as much as I'd like to say, we could meet again in 12 months' time and, the number of children on the street in the Philippines will have halved. There's just no way that's going to happen because we're dealing with such a big issue. But at least we have, some tools in place, I guess.
And how much do you think the civil society will end up shouldering the burden of the implementation, or at least, how important is the role for civil society to really monitor and push that forward?
I think that, the role of civil society is there. And it will continue to be there, and it's always been there. Like, we've been around, just before Gonzalo's team, 1987, we've been working on this issue, as many of the other organizations that have been working, and we'll continue to do that. We'd like to work ourselves out of job, but it's not going to happen soon. I definitely think that our role is to help keep people honest and keep people focusing back on the plan. What we've realized is, even though we've set up this subcommittee, which is institutionalized now, and it's got the presence of national government agencies, we still want to set up a parallel civil society organization or civil society network that can kind of, from the outside in, put that pressure on and so maintain that little bit of integrity that's separate from the government, that can also be a bit of a pressure point. So we unfortunately don't see ourselves being able to stop anytime very soon. But also, the plan doesn't. It does give some. There are some deliverables that are kind of directly, civil society is directly listed as contributing, but there are very few deliverables that are assigned particularly to civil society. We've definitely made sure that national government agencies are attached to each of the deliverables or the outputs that we're looking for. So we really are not planning to step in and shoulder their responsibilities for them, but hopefully to be there as capacity builders, as helping with accountability, helping with things like, it's as simple as, to a certain extent, the general comment calls for a rights-based approach. And one of the major, barriers at the very beginning is that we don't believe that most of the government agencies really understand what that actually is. They've signed up to it, they've incorporated it into the national plan, but at a very basic conceptual understanding of it, that they don't have that. So we see our role as stepping in and providing that kind of training, those kind of resources, helping people to, it's going to be a gradual shift. It's not something that's going to happen immediately.
Sounds very much like the national plan is more the beginning than an achievement in and of itself, even though it's a great achievement, of course. It's also the beginning of many steps to follow and many further collaboration between civil society and government in both countries. I'm going to finish there. I realize that we're already long over time because of the challenges in the beginning. And thank you all for staying with us. I hope this has given some clarity and some useful insights for others who are hoping to develop national plans in their country. If you do still have any burning questions that weren't answered during this webinar, please don't hesitate to reach out to us. We will try and answer any questions that you might have. We can always do this via email as well. And we will make sure to send you the national plans that were developed in Uruguay and the Philippines to all attendees so that you can have a copy and see for yourself what it looks like. So I really want to thank both Gonzalo and Catherine for being with us today. I still have learned more, even though I'm talking regularly to both of you about all these processes. I've still learned something today. So I hope everyone else here on the call has learned more about the processes as well, and hopefully can take something away for their work as well. And finally, I also want to thank Retinos de US, who has funded a lot of this work, both in Uruguay and the Philippines, and the support we've been able to give Bahay, Tuluyan, and Gurises Unidos in doing this work. So I want to close it there. I'll hand back to Jess for any logistical housekeeping notes.
Hi, everyone. I think that was everything. Just to say again that the session has been recorded, so we can send around a recording afterwards if there's anything that you missed or anything that you wanted to listen to again. That will be sent around in the follow-up, along with the national plans that Lizette mentioned, that we can send around as well. And just to thank you again for your patience at the beginning of this session, and for bearing with us with the technical difficulties. We promise next time we do a webinar, we will have everything running as smoothly as it should have done this time. So
don't make that promise.
It's being recorded, so I've made the promise now. And just to, thank you for your participation and for your questions, and we'll be in touch, and hope you'll have a good rest of day and evening wherever you are.
Thank you. Thank you.
Thank
Everyone.
you.
Thank you.
And thank you, Mariella, as well, for the excellent translation.
Well, thank you.
Thank you, Mariela.
Thank you. Bye.
Bye, everyone.
Thanks, everyone. Have a good weekend. Bye.
Thanks, James.
Bye, everyone. Thanks.
Was there anything that you wanted me to stay on for, Lizette, or shall I leave? I think, as I'm the co-host.
I just didn't want to end it in case there was anything with the recording.
Okay, I'll leave then, and I'll catch you in a bit.